Welcome back to How to Medicate and welcome to this new video on psychosis and how to treat it. This video is part of a video series on mental health problems, and for those of you interested, check out the playlist in the description after watching this video, of course. For those of you meeting for the first time, my name is Raoul. I'm a medical doctor from the Netherlands and I'm making weekly medical videos to educate myself as well as you, my viewers, because I believe that medically educated people make healthier decisions, which is the whole point of this channel and this video. This video also comes with a quick disclaimer. It's meant purely informative. This is not medical advice. And if you're looking for medical advice, always contact your own doctor. And now quickly, let's get learning. So as promised, we will start this video off by explaining exactly what a psychosis is. A psychosis can be described as a condition that affects the way your brain processes information. It can cause people to lose touch with reality and may lead to delusions and hallucinations. A delusion is a false belief of reality, which a person keeps on believing despite obvious truth to the contrary. As an example, psychotic people commonly believe they are spied on, drugged, followed or cheated on. And hallucinations are where someone hears, tastes, sees or feels things that don't exist outside of their mind. Other common symptoms are disorganization in speech, thinking and movement. This may cause people with a psychosis to rapidly change topic while speaking. It may lead to incomprehensible speech and it may cause repetitive, odd and sometimes purposeless movements. In addition, people with a psychosis may experience a lack of motivation, a reduced emotional expression and sleeping problems. Psychosis itself is only considered a symptom, which may be part of several medical problems like schizophrenia, depression, bipolar disorder, schizoaffective disorder, delusional disorder, schizotypal personality disorder, paranoid personality disorder, post-traumatic stress disorder, and obsessive-compulsive disorder. Besides mental health disorders, it can also be caused by several other conditions like severe sleep deprivation, extreme stress, traumatic life events, especially childhood trauma, substance abuse, brain injuries, several forms of cancer, and nutritional deficiencies like a vitamin B12 deficiency. Now, the underlying medical disorder can be diagnosed by a doctor or a mental health professional. First of all, your doctor should start off by a physical examination to rule out any physical medical problems. Tests may be done to exclude substance abuse, overuse of medication, causation by toxins, surgical complication, or other medical illnesses. Next up, your doctor will conduct a mental health evaluation by assessing your symptoms according to a diagnostic manual, the DSM-5. Depending on the underlying problem, this process may take several sessions. Which brings us to the prevalence of psychosis, which is just a fancy medical word explaining how common a certain illness or symptom is. Recent studies have shown us that a random person's risk to develop a psychosis in the following 12 months is about 0.39%. The lifetime risk of the general population is about 0.75%, which makes experiencing a psychosis quite rare. Which finally brings us to the possible treatment forms of a psychosis. And here I want to mention that the treatment can differ a lot depending on the underlying medical problem. However, there are a lot of similarities in first-line treatment for many mental health disorders, which may include lifestyle interventions, the usage of medication, psychological interventions, and social interventions. Therefore, let's start off with the basics. It's important to take good care of yourself, mentally but also physically. This means change your clothes at least a few times a week, shower regularly, maintain a tidy home and workplace, and keep a structured sleeping schedule. Try to wake up and sleep at fixed times and aim for 7 to 9 hours of sleep each night. Also, try to avoid sleeping during the day. In addition, it's often helpful to plan and fill your days. This may give purpose and helps with structuring them. When making your schedule, make sure to do some activities outside of your house. Sometimes a small walk may be enough. Next up, follow a healthy diet. Drink about 1.5 to 2 liters of water a day, eat enough vegetables and fruit, and make sure you get enough vitamins. Lastly, try to stay in touch with your loved ones, your friends, family and colleagues. Maintaining social contacts may contribute positively to your mental health. You could do this by physically meeting up, but sometimes calling or WhatsApping your friends or family will go a long way. Which brings us to the next treatment step, the usage of medication. When treating a psychosis, your physician might commonly prescribe you antipsychotics. The choice of which antipsychotic to use is based on experience, effectivity, possible side effects, the risks and costs. Examples are olanzapine, clozapine, risperidone, quetiapine and aripiprazole. Depending on the underlying medical problem, your doctor might also prescribe you antidepressants, mood stabilizers or anti-anxiety medication. I made an in-depth video on most of the specific drugs in each of these groups. For more information, check out the playlist in the description. Here I also want to add that finding the right medication for you might be quite a process of trial and error. Usually people may need to try several medications before they find the right one that works for them. This process requires patience and may be challenging. Next up, psychological treatment may also be helpful. This can be followed individually, as a family or in a group. Examples are cognitive behavioral therapy. This therapy aims to help you identify and understand your behavior, thought and negative beliefs. After which it tries to help you replacing negative thoughts and behavior with positive ones. Other possible beneficial treatments are verse training, acceptance and commitment therapy, interpersonal and social rhythm therapy, psychoeducation, and family-focused therapy. Now I hope this video was helpful and I hope you know now what a psychosis is and how it can be treated. If you have any questions, please discuss them with your prescribing doctor or place them in the comment section and I will do my best to answer each and every one of them. For those of you that want to keep on learning, check out the mentioned playlist in the description. And all that rests me now is to thank my sponsors on Patreon. Thank you Sebastian, who's an Investor Tier supporter, and thank all of you for watching my videos. If you did enjoy it, please leave a like, which will help out the channel tremendously, and consider subscribing. I'm trying to reach 100,000 subscribers before the end of the year, and you can help me reach that goal. For those of you that can't get enough, I also have an Instagram account @HowToMedicate. I'm posting there a few times a week, so check that out. And as always, I will see you next week with 2 new videos. Bye bye.